All right. All right, so we should start. Who from the SAB is here? I see Susan Foley, Joe Abley, Amy. So we have a quorum. Kim, are you there?
I don't see her in the list.
Okay. What we do in the interest of time, why don't we start in if that's okay with everybody?
Mr. Chair,
I'm
before
sorry?
a procedural matter, before we begin, this is Deanne Elliott. I'm wondering if I could have a local Zoom recording enabled.
All right. Do I have a yay on that, please?
I think it's the chair's discretion. I don't even know if you need it.
Okay, if it's the chair's discretion, please do. But I'm not able to obviously do that, but please do.
Yes, we
Thank
don't
you.
have that. We don't have that setting enabled because MCB is recording and posting the meeting.
It's my understanding that participants can also make a local Zoom recording after notifying the chair.
Yeah, didn't we do that? Didn't we do that last time?
I think we did that last time.
Yes, we
Yeah.
did.
Well, I'm sorry, David, with the new process. I believe that we are recording and posting, but I believe anyone is able. Correct
Please,
me if I'm
who's,
wrong. I believe anyone is able.
Please
to
identify
record.
who's speaking. Please
I'm sorry, this
identify.
is Regina.
Okay.
What I would say is anybody who wants to record, good luck.
Do
You
so.
do whatever you like. Free country.
I think you can do so at your own discretion, but we don't have that setting in Zoom right now.
Well, we have to have it enabled for us to create local recordings. That setting has to be enabled or we can't make local recordings.
Right, David, I'm not sure if you want to chime in here, but I believe.
I mean, is that something you can just turn on? I mean, yeah.
No, not while the meeting's already started, no.
Okay.
But we are recording and it will be posted to the SAB landing page.
So I'm hearing a no.
I'm hearing a no because you're unable.
Actually, we sent an email a couple of months ago outlining some technical steps to enable that feature, which should be kind of straightforward.
So I have a statement here regarding our recordings that I can read quickly, Joe, if you don't mind. And I
Please.
believe Carla is also going to, when she joins the meeting, speak about recordings. Oh, she's here. So this is Regina again. What I have here is the meeting is being recorded by the host, the Massachusetts Commission for the Blind. Please be aware that anyone who disrupts the meeting may be removed from the meeting and will not be able to rejoin. So just be aware of whether you're muted or unmuted. Recordings of SAB meetings can be found via the button on the SAB landing page available on mass.gov/MCB. After they are posted or can be found directly on MCB's YouTube channel in a SAB playlist. MCB will post the meetings in 7 business days. Should you need assistance finding a meeting recording, please contact MCB info@mass.gov, or you can call 617-626-7503. Reasonable accommodations for people with disabilities are available upon request. To submit a request, please contact MCB ADA Coordinator Camilla Drogos at 617-279-3332 or Camilla, K-A-M-I-L-I-A .Drogos, D-R-O-G-O-S-Z @mass.gov. As part of your request, please include a description of the accommodation you will need and include as much detail as you can. Please provide your contact information in case we need more information. When possible, please allow at least 2 weeks in 14 days advance notice. Last minute requests will be accepted, but may be impossible to fill. To learn more, you can visit mass.gov/MCB. You can call 1-800-392-6450 or email mcbinfo@mass.gov. And we also have social media outlets on LinkedIn, Twitter, Instagram, Facebook, and YouTube. And I will see if I can post these links in this information as well.
Could you forward to, well, I don't want to give my personal email address.
Yeah, I can
publicly.
send,
Could you forward
send
it
all of
to-
this to you, Deanne.
Oh, if you could do that. And also if you could take that policy and distribute it to the SAB so that they have it as well. I disagree with this policy. It's not consistent with my understanding of the open meeting law.
Yeah.
So I'm interested in having more discussions about
Okay.
that, but I don't want to take up any more of your time.
This is
So-
David. Lauren is on vacation.
Mm.
Otherwise, I'm sure she could probably explain this, because I think that's coming from her, Regina, what you just read.
Yes, I believe so.
Yeah, Lauren and I have spoken about this before, and I've had a couple of conversations outside of MCB with the Open Government Division, and I think we have sort of a difference of opinion in the interpretation. So yeah, if you could get a copy of that to me, I'd very much appreciate it. Thank you.
Yes,
All right.
and Joe, if I might add, this is Susan, also a member of the SAB. My understanding of the open meeting law is that if we are requested for a local recording, that the chair has the ability to agree. And it sounds
Which I
like
did.
you do agree, but MCB is saying that they do not have the technological capacity to perform that. Is that a correct understanding of what just happened?
That is what I just heard. Is that correct, Regina?
Yes, we don't have that setting available at the moment because we are recording and posting the meeting. I don't know if Carla wanted to add anything.
But the bottom line for the public, just know this meeting will be available on our YouTube channel probably sometime next week.
But that's very different. This is Amy, sorry. That's very different than allowing the public to make a recording. And it should not, in my view, be anything about an accommodation. It should be any member of the public. It has nothing to do with disability.
Okay, fine. I'm just letting you know that it'll be available.
This
I-
is
it-
this is
it-
Kestrel Verlinger. I am an advocate for disability and technology, and I want it to be known that the standard Zoom interface, which allows visually impaired people to use a number of buttons, including start recording and raise hand, have been removed from the interface for this meeting. They do not exist and are not available to
Yeah.
us as users. Though
Castro, let me interject for a moment?
coincidentally, start video is available.
Yeah, so they haven't been removed. As you may be aware, Zoom has a variety of different accounts. Each account comes with different capabilities. The particular account we're using here allows for a large amount of users. So it's certainly not intentional. We want to make everything open and available to everyone, just to be clear. But that, I think, has something to do with it. And is Carla here yet?
I am
Right.
here.
Hi, Carla.
Hello.
Maybe Carla is Zoom host Maven 1. She knows. Carla, maybe you could give the audience here just a little bit of a delineation of what I was just referring to between like the various versions and various features that may or may not be naturally enabled.
Yes, absolutely. So what we're using right now is a Zoom meeting account. We have the capability, I believe, on this account for 500 participants. And depending on how you set up the meeting, different recording allowances and interaction possibilities are there. You have to do it before you start the meeting. And once you start the meeting, all bets are off as to what you're able to do and not do without getting out of the meeting and coming back in. But it seems to me that right now, I'm joining just as a participant, like all of you. So it seems that I do have the ability to raise my hand, also to mute and unmute, to start, stop video, as well as to chat. I don't know if that's, there for everyone. If you'd like me to share the shortcuts, if you're joining a different way, I'm joining via a laptop computer. I can definitely do that if that's helpful.
This
But
is Deanne.
Carla, this
Yep.
is Sharon and Strakowski. We definitely have that capability.
Okay, good. Just
I
wanted
just
to
can't
confirm
record
that.
because I just pressed Alt R and it said, please ask permission from Zoom host.
Right, and that, Deanne, I think is what Regina was mentioning, that as the host of the meeting, MCB is recording, and then within 7 business days, posting on our YouTube channel in the SAB playlist. And that link will be shared on the SAB landing page via a button that goes to our YouTube playlist directly. So we're hoping that, and the reason why we set it up that way is because we're hoping that the SAB landing page becomes a great reference for all of you to know about upcoming meetings, also to read the minutes from the meetings, also to find the agendas for upcoming meetings, and then to have that one-click button to access the recording playlist for SAB. Right now, there's only one SAB recording, and that was the previous meeting, but this one will be posted within 7 business days.
All right, so I'm gonna, so we can move it on with the meeting. I guess that however you do this technically, future SAB meetings should have the ability to both have MCB record and then to allow anyone else who wants to record. Apparently, from what I heard, Carla, that you need to set that up ahead of time. Now,
that's correct, Joe.
And I do think that some of the participants on the call have made it clear, but I guess it's too late now. Because I'm not technologically very savvy, that a link to the recording on YouTube, wherever it happens to be, will be on the SAB page.
Correct. Yes.
People will be able to get it. So the request going forward is that everyone that's on should have the ability to record. And I think there's kind of no argument about the desire or the legality or anything else. I think that there are certain people on that want to make sure that we're following the open meeting laws, and that, so with that.
Joe, this is Kim.
Yes, hi, Kim.
Hi. So I agree with everything you said, and I really want to see consumers have the ability to record. So I hope that our September meeting will offer that ability and we can move on from this topic. I do want to just express another concern related to the meetings and communication, and that's the issue of distribution of the link for the meetings. I feel that there's been a little bit of a, it hasn't been real transparent or out there that telling people that they can go to the website and get the link. Some of our MCB consumers, while they might use email and do that well, sometimes they don't have the comfort level of going and navigating the website to find the link. So, I mean, I'd like to have Carla consider having a distribution list for consumers who indicate that they would like to be notified of the meetings so that they can attend them, and to consider that for future communication rather than just pushing everybody to the website when it's not that easy for some folks who are using an iPhone or whatever to do that. I think we have to look at everybody's capability levels and their technological skills. And I mean, I was late to the meeting today by a few minutes because the place where I was expecting to see the link to the meeting in Regina's message didn't have the link, and I had to go to the website. So there's some convenience issues too. I mean, I'd like the SAB to get the email for the link, you know, as well, just to make it easier and quicker.
So I had understood from Regina that forwarding the link that she sends creates calendar issues in Outlook. So I appreciate that.
Correct.
But is there any reason why the Zoom link can't be sent to consumers that are on the MCB email list?
Joe, it's Regina. So just to clarify, the Zoom info and the Zoom link can be sent to anyone, can be copied and pasted and sent to absolutely anyone that wants to attend. I was just asking that it's not directly a forward of the calendar invite.
Yeah, no.
Yeah.
I understood that and appreciate it. But my point is that for me, I had to ask you for the link earlier this
So
week.
the answer there is I'll put on, I know what Lauren would say. She would say, no, we are not that agency unless our consumers have agreed and checked the box saying, yes, send me notifications. We're not spamming them. We're not sending them.
I got it. I understand that this would be to any consumer that would allow notifications.
Right.
Yes.
So within the,
That's right. And my
I think,
request was that consumers self-identify that they'd like to receive the link for the meetings and that a list be maintained.
Yes. How many are we up to, Carla, on that list? It's a small list.
Are we discussing our stakeholder? We have two separate email lists. We have a stakeholder email list and we have
Which
a
it goes out
larger-
to that list automatically.
Right.
and we have a larger email list of individuals who have opted in to receive our e-newsletter and other event communications. We do include upcoming event links. Those links do go to our website because it is an e-newsletter. They do go to our website where you can find the event information about meetings like the upcoming SAB meetings. The issue has been that in the past, we haven't confirmed meeting dates with the SAB previously. So if we can get those dates in advance and we can schedule those Zoom links, it will be a lot easier to put those right there and to include them in all outgoing communications moving forward so that people do have greater access.
yeah, I mean, this was, Carla, this has been on the calendar for quite some time. And we'll get September on the calendar. And our request is, if I hear Kim, correct me if I'm wrong, is as wide a distribution as you can by email to those that will accept the notification of the newsletter and so forth, so that people aren't asking or hunting and pecking looking for the link. It was kind of difficult. So what I'd like to do with that is to open the meeting. I'm going to act as chair today. Unfortunately, Chris Cotters is very ill. We had hoped that Chris would be able to join us today, and he didn't. And I would appreciate everyone keeping Chris in your thoughts, please. So with that, I'd like to, from the SAB, entertain a motion to accept the minutes to the June 18th, 2021 meeting. May I have a motion?
So moved. This is Kim.
Second, Amy.
Okay, Amy, second. All in
Seconded,
favor?
Susan, all in favor.
Okay,
Aye.
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 Okay. This was a note from Chris, and the next item says, expression by the chair that the SAB is only notified of material policy changes after they are implemented, and that we are being deprived of our ability to give advice subsequent to the implementation. And just to clarify what Chris is looking for, that there've been a variety of things. I don't want to get too deep into it, but such as the office closings, reallotment projects, the takeover of the AIM library, that the SAB seems to hear about after it's a done deal and not being able to act in our consultative and advisory process to the commission and the commissioner. And so the request is that please, as you're considering major material things that impact particularly the consumers, that we're told in advance and we're able to have a discussion and a roundabout discussion, recognizing the commission is going to make the decisions that he believes are in the best interest, but we would like to weigh in with some input. I would also like to welcome any members of the public attending the meeting. How many are on, Regina?
We currently have 32 participants, and also, Joe, I do have someone with their hand raised. I'm not sure if you want to wait until the end to take public comment, but if you want to just let me know, I can.
So what
Step in.
I'd like to do is take a few minutes now to have questions and comments and then move on. And I see that both Kestrel and Debbie have their hands full.
Yes,
and
Debbie has had her.
508 Yeah.
Yep, Debbie
and-
has had her hand raised for a little bit now. If she, do you want her to
Okay, so,
unmute?
yeah, please, Debbie.
Okay.
Debbie, you're muted.
Am I muted now?
Yes.
You are.
Yeah.
Okay, all right. Now I just raised my hand early because I couldn't find the hand button. So so I don't know if you need to explain to people because of the new interface, it's not in the usual spot. But yeah, I have a couple things I want to ask. I read the agenda and I didn't see any discussion about kind of what happened last week, and we weren't allowed to ask questions after the meeting took place, and especially after some of the members who work for MCB spoke. I know SAB got to ask last week's guests a few questions, but there was no opportunity for like consumers to ask any questions. And then I was a little surprised that that wasn't kind of like the first thing on your agenda, because I was a little taken back by some of their comments and what they said. And I feel like I've been presented this picture that everything's been going swimmingly since COVID, and everything that's been done and integrated, and office closings, and everyone was adapting just fine. And it was all working so perfectly according to open houses and meetings and everything else. And then come to find out it's not. And these issues directly affect the very people who are to be served, like me. And I was just a little surprised that it was kind of presented and then move on. And then it doesn't seem to me, maybe behind the scenes, everyone's been talking and solving all these issues, but I didn't see it on the agenda. And I don't know if I address this to you or to the commission, because the commissioner recused himself. So maybe he doesn't even know what's going on. Do you guys talk about this? I'm just a little confused because I thought things were a little different. And now hearing from some of the people who work at, with us, that it's been a rough ride in the situation that was set up temporarily to adjust for COVID is not a model to go forward with. And that the office closings, the little holes in the wall that have been given, are not sufficient. It doesn't work. So, and that's just one thing. I know there were many issues brought up. I don't have them all at the top of my mind. But what I'm concerned about is here's yet another issue brought forward to the SAB that now we all seem to be aware of. And where does it go from here? Is something going on? Are we going to fix these things? What's happening?
I mean, I'll and Debbie, thank you for the question. And maybe we should take questions towards the end of the meeting to make sure that things are addressed. So you know that we don't meet between meetings. There's the complexities of the open meeting laws. So when we get together with ourselves and with the commissioner and others, it is in these forums which are open to the public. I think that, and I think the minutes are also public, if that is correct. So it is in the minutes. So I don't know, David, if you'd like to address for a minute the issues that were raised by the union. I think, where that stands, I think it's a fair question by Debbie. But it was surfaced by the representatives at the meeting. And, we obviously don't have the teeth to take to take any action. That is between the commission, the commissioner, and the union. David?
Yeah, thanks. And thanks, Debbie, for your comments. So specifically, I am not able and not going to address any of the union negotiations. That would not be appropriate. Further, any discussions regarding personnel matters and what their likes or wants or desires are, those are confidential personnel matters. I'm not going to discuss those either. What I would say generally is, though, have we looked at the positive side? Yes, we have. During COVID, COVID has been very challenging. Nobody is going to argue that. Nobody, you're not going to hear me saying there was no issues whatsoever. I've never said that. Further, I'm a positive person, and I try to run the organization, the MCB as an agency, as a positive thing. So we're always emphasizing the positive things. That doesn't mean that challenges don't exist. A lot of challenges have existed. I think we've acknowledged those. We're working through those with dialogue, both with the union and the employees. Some of them will come to bear in this meeting. We'll discuss some of the other things that have gone on. So I understand and I appreciate your input, but I can't address specific union issues or personnel issues. And I don't think we've made everything just look like, oh, there's no issues at all. Look, there's been very real challenges, but there's been a lot of opportunities too. We're one of the only VR agencies in the country to show gains. All the others are showing losses. We're showing gains. That's significant. That's a good thing. That's a positive thing. So that's just, that's just the fact and the data. And many of the other good things that we've done too are backed up by facts and data. When you have a 35 or whatever it is now, $36 million organization with 138 employees inside the context of 21,000 person secretariat, 44,000 executive branch, that's a complex organization with complex issues in an unprecedented time that we've tried to work through. So we've tried to be creative. There are certainly challenges. I just choose to focus on the opportunities.
So I guess, and I'd ask other members of the SAB to weigh in. David, can you assure us or advise us that the commission is working with the union to address the issues that have been raised so that things can, going forward, be managed in a smoother
Yes.
basis? So
Yes.
I think that's kind of the answer, right?
Yeah, we have gotten another communication, it sounds ominous, but it's really just a way to get to the bargaining table. It's a document called a demand to bargain. And so we're working through some issues that were raised, and because we had talked about a gradual reentry, and so some of the members raised concerns and issues, and so we're going back and forth, and we're having a good dialogue, and we're working to resolve it. And oh, by the way, this is a very fluid situation. Plans that we had 3 weeks ago have now, with the CDC guidance getting changed just this week, we've got to now adjust to that. So the fluidity of the situation here matters as well. We're trying to adjust, and we're in a dialogue. I think it's a good thing. Matter of fact, I'm very confident in the union leadership and our staff, because we've been through very challenging times, and I think we're in a really good place. Look, do challenges still remain? Absolutely. But I'm a positive person, and I just think that we've got so many good things to talk about. I just want to focus on that.
All right, Kestrel?
Joe? And then-
Yes.
Wait,
Oh, I'm sorry.
sorry, this is Amy. Joe, you said you wanted other members of the
Yes,
staff?
please.
Okay, David, I certainly understand and appreciate the fact that, and would not expect you ever to discuss personnel matters or bargaining issues. I think what Debbie's really asking, and I think what I've heard other consumers ask as well, is, how do consumers understand, and what is your response to the issues and concerns that were raised by the union last month? Not involving personnel, not involving those things, but involving the qualities of service issues that they presented.
Yeah, I'm not sure how we could discuss that. Maybe potentially there would be a way to discuss that. without violating our good faith in the agreement, which we're bound by law with bargaining and things like that. I wouldn't want to try to have inappropriate, what they call leverage. So that's why I'm just steering clear of that out of respect for them and their position, their bargaining position. I don't want to compromise either side's bargaining.
No, and I certainly
These are
wouldn't want you to
bargained
do that
issues. These
either.
are issues, the very nature of what you're talking about. These are what are being bargained.
Joe, this is Kim.
Yes, Kim.
I just wanted to say that I support what Amy has just said. These are real concerns of consumers. And I, for one, am thrilled that there are 30 consumers here at this meeting today. It shows that they care about MCB. They care about the services being provided by the staff at MCB. And I think it's incredibly important for us to listen to their concerns. I don't think it's unreasonable, for example, for our consumers to be concerned that the staff potentially who may come to work with them, on orientation and mobility or rehabilitation teaching, have vaccinations. I think that's a reasonable thing, just as it's a reasonable thing on the other side of the equation for staff to have some expectations that they're working with the consumer who has been vaccinated. In fact, a program that I supervise here at Perkins, the I Can Connect program, has attestations on both sides of the equation, the trainers and the consumers, to ensure that safety is clear to all parties and that there is a protocol in place. So I'm hoping that MCB is working on such a protocol to allow staff to work directly with clients so that they can be assured that they are safe, and working with someone who's vaccinated. And things are changing so quickly. I absolutely hear what you're saying, David, and I understand the union related issues, but there's just some fundamental principles here about consumer safety. And I think those are valid concerns, that consumers need to know something is being done to protect their safety when they're interacting with staff from the agencies. So I would urge you to try to be able to share something about that, or that you're working on a policy with the union that will have some kind of attestation on both sides to ensure the safety of the staff and the consumers.
Were the policies that MCB gave with respect to COVID protocols that the union raised as an issue, was that something that MCB promulgated? Is that something EOHS promulgated? Has the commission spoken to the Carroll Center and to Perkins and to MAMFI and others that have direct consumer touch points about how they are handling it?
So there's a bunch of questions there. So what I would say is we're in constant communication with all of our vendors on various levels. And I'll just leave it at that. What our vendors are going to do, our vendors are going to do. We do consult with them. And again, I'll leave it with that because I don't want to speak for each individual vendor, because I think they have different policies.
Well, I'm sure they have different policies. What I'm talking about is there could be a best practice that Perkins or the Carroll Center or MAMFI or the Lowell Association
and
are doing that the commission could adopt. And by the way, the vendors could adopt the best practice that the commission is doing. Or is this something that was just sort of, these are our rules and that the union is now bucking it?
To be clear, safety has been our top priority since March, well, always, but heightened with COVID since March 13th of 2020. All of the decisions that we have made, safety is the first threshold to cross. If we can't take good, reasonable, and rational steps to ensure safety, then we don't do it. So all of the policies, procedures, programs and services that we deliver, safety is the first thing, both at MCB and then to your question, where did they come from? With our partners at EHS, with our partners at the command center and the larger administration, HRD, and all of the agencies within the enterprise of state government. Part of the thing is any action that any other agency takes, we're very aware could become like some type of, well, now there is a best practice, or now there is, like you've set a precedence, and so now all the agencies are. So I think the government has been very deliberative and tried to internally have good communication to ensure that what one agency is doing is reflective in another agency, and so on and so on and so on. So it's safety first. That's what we're in that dialogue now. We last Friday, so everybody should know. So we were doing coffee with the commissioners every Friday. A few months back, we switched to every other Friday. So last Friday, we had a coffee with the commissioner. It's usually an hour. I think we stayed for Carla and Regina. Was it 2.5 hours? And we covered nothing but all of our proposal of the gradual transition back to, or transition to this new hybrid model that we proposed. So many of these.
So just sort of so we can move on. It seems to me that when you do something like this, it should probably be done in connection with a collaboration with the union, so that instead of promulgating a rule to the union that they didn't participate in, they decide that they're now upset about it.
But they did participate. They did participate before we released it. They participated, we released it. Then at the coffee with the commissioner, additional questions and comments were raised. So we raised those up to, again, the executive office and command center and all the people on our side. We're now then re-engaging with the union to follow back up on these things. And when we're having dialogue, and when we have some type of consensus, or when we're able to settle on what it is, we will then go back to the staff and say, hey, we've followed up, and this is what we're proposing now.
Okay. Well, we encourage you to have the discussion with the union so that everybody is on the same page. Kestrel,
We've been having it all along.
Do you have a question, Kestrel?
Yes, a couple of weeks ago, I received an advertising flyer from MCB, and it was addressed to a different MCB consumer. After asking a few questions, I found out that there was a wide scale data leak at MCB and sending out these flyers where large numbers of MCB consumers received these flyers, and every one of us had someone else's name on it. So I had someone else's name and somebody else has my name. Now, MCB is supposed to ensure confidentiality in regard to the names of its consumers. And in addition, as someone who is involved in writing and researching a guide about security and privacy for people with visual disabilities, I'm concerned how the release of this information, this data leak, into the public could be used by hackers and scammers to further victimize seniors and people with disabilities who are all already at a high risk of being victimized by these groups. And I would like to know how wide scale was the data leak, and is there going to be any further action on the part of MCB to notify their consumers so that they can be prepared and be on guard in regard to the possibility of being contacted by scammers who use this information?
Yeah, so, okay, let's go through what you said. Part of what you said is accurate, part isn't. I wouldn't say it was a data leak. There was no data leak.
Excuse me, Commissioner, but the release of confidential information into an unsecured environment is indeed the definition of a data lake.
Yeah.
Aside from my
People's addresses are public information. People's names and addresses are additionally public information. So there was no personal information on there other than
People's-
the mix-up that occurred between a juxtaposition of some of the consumers' names with some of their addresses. That was a mistake. Yes, we made a mistake. And we're working, we have a whole plan set up and team set up. And is Mary here? Mary? Is she? We have a whole plan and team and set of meetings to address this. It is troubling. We reacted immediately. I don't like the fact that we made a mistake. But again, after checking, we were talking to Lauren, checking everything else. Leak is different. Leak means like we exposed everybody's information on some aspects. No, this is a one-off type of situation. Again, it's not acceptable by me, and we made a mistake. But it's not like we sent out the list and everybody has everybody else's information. Which, by the way, just to be clear again, you can go down to your local city and town hall and get everybody's name and address and more information. It does bother me, however, that their status as one of our consumers potentially could be misconstrued in some way. But again, it would be a one-off basis. It wouldn't, nobody would have the ability to be able to get more than one or two or something.
What was this, or should this have been reported up to EOHS?
Yes, it was. We did a critical incident report to them and notified them that we made a mistake and that there was, and it exposed really that we need to have better and more modern policies, procedures, and controls on how we handle the data. And just to be fully transparent, this was in an effort to shield our consumers of risk, meaning not giving the mailing company all of our full information purposely to try to be it so that they can't have the blind mailing list or whatever. In the effort to do that, ironically, that's how we messed up, because we didn't have any data hygiene list management there. And that I think to me is a mistake. Like, we need to be able to get better policies, more modern policies, procedures, and controls to be able to match the name with the address ahead of time so that this doesn't occur again. Is Mary out there? Mary Odiato?
I am
All right.
David.
Hi, Mary, because Mary is not only our ombudsman, but Central Registry was working on this project. Mary, did you hear my description there? Do you want to add anything?
Yes, I did. And so I'd just like to add that we did receive some inquiries from consumers about, we sent out, let's say, about 26,000 mailings, and we got about 15 individuals who did reach out to MCB just to make sure that their information was not compromised. We did have a statement out to our counselors, and whenever we got an email, it said we let them know that we apologize for the clerical error that led to you receiving a mailing from MCB to the incorrect recipient. Please be assured that your information in our registration database is accurate and up to date. The mailing that you received is an overview of our agency's mission and services, so we hope it's valuable for our entire community. Please reach out to your MCB counselor if you have any questions, or call our main line. And so, yes, we did have a few people calling.
So
And
may I ask why that notification wasn't made more widely available? I mean, there's a pretty long chain of finding the right person to call and leaving it to the consumer to figure out what they're supposed to do to inquire about this. And
Yes.
we're already visually impaired, which makes it more complicated. What, couldn't we have been notified through some sort of
Yes.
email?
So we contemplated that, And one of the things we look to measure to see how much, because the scale, we didn't know the scale. So we were going to see, like, did we get a ton of calls, a ton of emails? We got some, but we didn't feel it rose to the level of alerting everybody because, again, the large majority of our community wasn't impacted, wasn't affected in any way.
Well, if this is Amy, if I may ask a follow-up question. If you weren't sure what scope of the breach was, and when I say breach, I mean breach in terms of blindness status, then how would you know what the impact was?
We were gauging that by the calls and emails we got back. When we didn't get a very large volume back, we didn't think it rose to the level of alerting all 26,000. We monitored that by the hour, right? And then Mary and Carla, what did we end up getting back total for responses? It was like less than 100, I think.
Isn't there an issue, however, that you were sending out paper mail to visually impaired people who might not have access to someone
Yes.
sighted who could read
Yep.
that? I mean,
So the large majority of our consumers have some usable vision. The ones that do not, we do try to have alternative means available. So it's not perfect, but if there's another way, if anybody has another idea, bring that forward.
I mean,
David,
I
I think it should go, I think that there needs to be widespread communication of this, because I think, as Kestrel has eloquently stated, we do have a more vulnerable population. And I also think that, you know, announcements could have been made on Newsline. Announcement could have been sent to your consumer opt-in email list. Announcements, and I don't know whether you were planning to announce this today before Kestrel brought it up, but I think in any kind of a meeting or an announcement to stakeholders or anything like this, this needs to be communicated widely.
if this was a corporation instead of a government agency, there would be guidelines in which it would be expected to notify its consumers and also to acknowledge that the mistake had been made, what the scope of the breach was. And
Yeah, I think you heard, Miss Mary, that we did have that and we have done that and we will continue to provide all of that.
So this is Mary again. I would just like to add that we are now tightening out our data policy so that we have checks and balances. No mailing or nothing goes out without more than 2 people looking at it. And also going forward, if something like this ever happens, some of the steps that are going to be taken, and I believe the SAB will be part of the process of just making sure that our policy is tight enough. So when we meet in September, that would be one of the articles on the
yeah, and just to be clear, one of the things around this is at the end of the fiscal year, when you're spending, when you're we're scrambling to try to spend rather than revert the money. We weren't even planning on doing a mailing until we realized, oh, we're going to have this extra money. Let's do a mailing. Carla pulled together an excellent mailing. We worked with our VRTs to do it in large print with great contrast. We did like some focus groups on it and as much as we could to make it as accessible as we could. And it's general information. Nothing on that is specific information. Again, we made a mistake. I'm bothered by that. We're now working to improve that.
yeah, I mean, there seems to be something with the process that needs to be reviewed. If this is going to be discussed at the September SAB, I mean, the horse is out of the barn. I'm not sure what more can be discussed now.
This is Kestrel. I'm also the person who brought up the issue of the survey questions, which asked about people's sexual preferences.
That is on the agenda, Kestrel, for the commissioner to address.
I just want to bring that up in relation to this, that I think the consumers should have more say in how our information is being used, distributed, and perhaps even accidentally leaked. All of this is just disturbing to me, that it seems there's not a professional level of that would be expected from any other agency, government agency, or a professional company. And it's disturbing to me as a consumer. who's
Yeah, I'm not sure what
currently-
you're using to base your decision there, other than a mistake we made on a generic mailer, which only impacted people on a one-off basis. Again, we've made a mistake. It's unacceptable. We're addressing, and we're going to have better policies, procedures, and controls in the future. But any other thing that, like, we're not handling the information, I don't know what information you're using to base that on, because that's paramount to us.
I'm basing it on the basic policies and procedures that are used by professional companies when they have experienced a data leak, and what is expected in their reaction to their consumers.
Again, but it's not a data leak. A data leak is something when information gets compromised. The information was not compromised here. We made a clerical error.
But names are released into the public. That makes it a data leak when the names are
No,
supposed to be
no, the
confidential.
public is more than one person. This was a one-by-one basis. So unless you went and looked in other people's mailboxes, which is against the law, you couldn't get more than one other person.
But that's one person who could be victimized by
There
a
is no public, but all of the information is public information. Other than this, and by the way, just because it goes to somebody's house doesn't mean the person even knows their status necessarily.
They might not be living in a house. They might be living in an apartment building where mail is just open to the public. It might be left
Yeah.
in a mailbox on a public
Yeah, so
street.
we could go around and around. We're admitting we made a mistake. We made a clerical error. It bothers me that we made it. I don't want to make it. And quite frankly, the existing state law, state regulations and policies, I would argue, inhibited our ability. The modern way to do it is to match our list with a list maintenance company organization and put it through that. Right now, we don't have the agreements in place to be able to do that. We need to get to that place. Because when we send out even just our certificate of blindness, which goes out on a one-on-one basis, we're getting those returned in the mail because the addresses are, or the person's, address is different. So we're working actively to improve the policies, procedures, and controls around this. But it's not fair to make it seem to the public like, oh, MCB doesn't know what they're doing, or there's some breach or leak. None of that is true. Your information is secure, and people should know your information is secure with us. And it's so secure with us. We're making mistakes trying to get it out, trying to get mailing lists out.
Kestrel, you've been very articulate, and I think you're right. But I'm not sure what more can be done now other than
Yes,
much more vigilance on the part of the commission.
I
I'm,
think we need to move forward.
yes,
Yeah,
I'm
we do
done.
need to move forward,
I'm
please.
done. Thank you.
All right, there's one other question that we'll take quickly. It is 508. Can't quite read that. 564. I won't go through the rest of it, but please, your question, and please identify yourself.
Yes. Good morning, Mr. Chairman. My name is Jane Perry, and I'm from Region 5, Falmouth on Cape Cod. And I will yield my question respectfully to the end of the meeting, because I think there might be some things on the meeting that I would like to ask. I thank you for that indulgence, and I will wait to the end and raise my hand again. Thank you very much.
All right, thank you, Jane. All right, so moving on. Commissioner, status of the request that the SAB be provided with quarterly financials on an ongoing basis, and that the CFO or one of her colleagues be available for a short amount of time to answer budget-related questions. Commissioner.
Yes, so good news is we have our new budget director starting on Monday. So I think probably for the September meeting, we can have her at that meeting to be able to address whatever questions you have.
All right, so we got a summary financial an hour and a half before the meeting. I did send you back a question on that. So Chandra is not part of this meeting, correct?
Chandra is not.
Okay. We had a question for a follow-up on estimates, and I did send this to you in an email earlier, that we have year-to-date spending, which I presume is through June, for FY21. There is about a $6 million shortfall between what was spent and the GA, the approved budget from FY21. You were going to provide us with an update on what, if any, funds are going to be reverted, what, if any, funds are going to be retained by the commission and available for additional spending. Would you please address that?
Sure. Yeah, we're still in process of finding out that exact amount. Additionally, some of the difference is the federal accounts. There's that.
Mhm.
And then we're getting other payments specifically related to Chapter 257. Those were not initially planned. We're getting extra money for those increases.
You're receiving money or you're paying out money?
We're getting additional money.
Okay.
Additionally, we're getting what's called a PAC payment, which was basically from last year's budget, which we're getting additional money, which we weren't necessarily planning on.
So this will go into FY22, correct?
Some, and some of it is carry forward. So I think it probably depends upon how you look at it on a balance sheet of how much gets attributed to each area, but there will be like what I would call overlap there.
No, understood, but the
The
specific
exact
question,
amount of that, I don't know. I don't have that.
but the specific question, recognizing that in the VR side, we have an October federal year end, but that we spent, our spending is $5.9 million less than GA. I know you have money coming in. What happens to that $5.9 million?
Much of that, most of it, 5 point something, and again, because I don't have the exact reversion amount, but a very significant amount of that is either in process right now, meaning being programmed to be spent, or is the federal carryover piece, like, it's a federal type of account situation, or some of this carryover from the things that I just mentioned. There was another thing before you interjected, was a salary adjustment for union employees as well that is retroactive. So, and I can't give you that amount. I don't know if I'm at liberty to tell you that, but I will just say that that's part of it's not as it's not like simple math. It's not like you can just do that math and say, well, it's 5.9 and that's what you're gonna know. If I'm guessing the reversion amount, it's going to be slightly higher than we've done in previous years, but not significantly higher. Like, it's not going to be double. It's not going to be like many hundreds of thousands of dollars more or something like that.
So,
we did a great job.
So I do recognize then that some of the 5.9 million has been encumbered.
Correct.
And that it is due to retroactive pay increases, bills from the Carroll Center, bills from whatever.
Yes.
Bills from vendors. I got it. But when you get to the end of the day, there'll be an amount left.
Yes.
Some amount, which I guess you can't tell me. Tell us.
I'm not being evasive. I'm not being evasive. I don't know what it is. That's a guess until it happens.
But the basic question, okay, so we don't know what it is, but
probably going to be a few $100,000.
So it'll only be a few $100,000. Okay, thanks.
Probably.
All right. So, and on the financials, just as an aside, that you said that that we can go to the CT through, which is a link on the see-through, but that when I tried to use it, I couldn't use it. It just took me to a bunch of vendors. I did ask that Chandra spend a few minutes with me to give me a tutorial so I could use it. I never did hear from Chandra. So
there is a PowerPoint presentation that we made available. We can send it out to the group again.
I don't have it. If I got it, I don't remember it, but I'm
Okay.
one of these people that needs to be walked
Regina,
through.
can you make a
something.
note to make sure the group gets that?
But I would like to.
And Carla, maybe even post that on our website.
But I'd like somebody to kind of walk me through it, as opposed to me having a hunt and peck through a PowerPoint. I think that
We're in an excellent financial position. Is basically we have plenty of resources.
Based on the budget, you certainly are. And we did ask the question that Chris put in here. I'm going to ask it another way. What we had asked last time was that it looked as though the $850,000 earmark was going to stand,
which it did.
And your comment back to me was, well, we can't spend it if we don't have it. Well, you now have it. We asked you to anticipate how the $850,000 earmark was going to be spent. So would you report on that, please?
Sure. Well, we're gonna do our very best to make good on the particular language that also got passed along with that money, and speaks to assistive technology for seniors, a lot of it. So we're gonna try to do that, and the training that goes along with it. So I think there's two pieces. One is devices and stuff, that's magnifiers and machines and software and all that type of stuff. And then the other is the training that goes along with it. So,
and would you share with us what, now that we're in the fiscal year, there must be a specific plan related on how to do that? Is that going to be done by vendors? If so, which vendors?
Yes. Right. And so we're working with our contract people to try to ascertain what we have to put out for RFR and what we can just allocate. So we're working on that now. We've got a couple people on vacation, like Chandra's going away next week. John was on vacation this week. So we've had, where's my executive team? Mary, and we've had like 2 or 3 meetings already. And we'll be having more, probably another 2 or 3 meetings, and then coming up with a more detailed plan that we can make available to all the stakeholders to let them know of our intentions. But my guess would be some of it would be through existing vendors that we have relationships with. Some of it will be through new, quote unquote, new programming. And I think we're a little in the weeds here, but the comptroller wants to see, what does Max always tell me? Fair, competitive, transparent is like the comptroller and OSD. That's like their mantra. So, things that matter are, when's the last time a contract was put out to bid? So we got to go look at that. How many potential vendors are there already on the state contract that could do the service? That's another factor we got to look at. So there's all these factors we need to look at to be able to figure out what we can just spend and what we need to RFR. So we're in that process now, and then getting creative with what we want to do. Do we want to do new programming? Do we want to continue programming? What combination of that do we want to do?
So we're 1/12 into the new fiscal year and we haven't spent any of the money yet, right?
Well, remember, we still have plenty of money. We're still using money that we've had. So anybody who needs services is getting services.
No, I understand that. But what I understand is fiscal year ends. And if the money isn't encumbered, you can't encumber it after the end of the year. So
we have it all. Yeah, we're good there.
But what I'm talking about,
we're planning to spend all of it. We're endeavoring to spend all of it.
All right. So
that's our plan. And then spending plan comes out next Friday, I believe, is what I've heard. So sometimes that deadline sticks or sometimes they move it. If it does indeed come out next Friday, we'll really ramp up what we're doing to put a finer point on it. To be able
spending plan from who, David?
The spending plan is an exercise that comes from the Executive Office of Administration and Finance through each secretariat. So then the Executive Office of Health and Human Services Finance sends it to us. We say, hey, here's, pencil us in for, $1 million here, $1 million there, $1 million there. type of situation. We submit it, they approve it, they send it back to A&F, and A&F then gets an understanding of how much we've encumbered for what particular programs.
Okay. So on the budget itself that's been approved, congratulations, particularly with respect to account 1000. I think the increase is higher than anyone or any of the advocates thought.
I take it as a
Yes.
compliment because I think it's if not the largest, one of the largest increases that MCB has ever
Yeah,
had.
and I think the advocates also deserve a pat in the back. for
Sure,
really-
everybody, the whole
for
community.
really working on this. But
But
that,
we've really demonstrated, and Mary, are you out there again? We've really the plan that I've told you all from day one that I've had, the vision that I've had, and that our team has embraced and had is working. It really is, because through better engagement with the eye care community, better engagement with the consumers on a number of levels, whether it be communications, whether it be programs, whatever the case may be, we're seeing more people come to MCB than ever before. Mary, we have data there, right?
Yes, we do, and we'll get into it when we talk about the dashboards, Joe, if you'll excuse that for that.
I'm sorry, Mary?
So we have some data that we're going to share when we talk about dashboards, and it
Okay.
has some that are registration data as well.
All right, that's fine. So when we get there, we'll have Mary share the screen. And just, that it seems that with all this increase in money, that as people start coming out from under COVID to get services, a concern I would have is, do you have enough resources both within MCB, because there was a question raised about the adequacy of staff, and at your outside vendors, do you have plenty of capacity to take care of the demand and to spend the money in addition to the $850,000?
Yeah, it probably depends on the specific program. Generally, the answer I think is yes. But if we don't, then we'll go outside and we'll contract more if we need to. Nobody's going to be denied services. We're going to be able to provide more services to more people. So that's a good thing. So anybody who is legally blind in Massachusetts, you're going to be able to get access to programs. That's a good thing. We're at, I think, our FTE cap, we're at it, or if we're not, we've just gone on a hiring spree, if you will. We have a lot of new people in MCB, some of which have either just started or are starting within the next week or so. So that's a good thing. We're pretty close to capacity in terms of
Amy,
hiring.
I'm sorry, Amy, with a question. You said, David, and I'm glad to hear you're going to be trying to be innovative and to think about, different, since we have this money that we now have available, this relative riches for MCB, have you and or do you plan on soliciting suggestions from the blind community about ways in which they would like to be served regarding technology, as an example?
Yes, there'll definitely be components. And again, I think part of that will depend upon what our contracts and what we hear from OSD and the comptroller in terms of what we need to quote unquote put out.
Mm-hmm.
So we'll definitely be doing outreach. A lot of it's going to be tried and true. Some of it will be new.
Okay. All right, moving on, and this addresses Kestrel's question from last year. Verizon questionnaire that must be completed by applicants for MCB services in light of particular concerns of the LGBTQ trans consumers and discussion of other concerns they may have.
Yeah, so the survey is complete, and we addressed that with the PCG, the vendor that helped with implementation of the survey. We certainly know now for next year that when we do it again, because we're going to be doing this annually, to we'll solicit more input. We thought we were using best practice. We think we did use best practice, but we will go back out to get further input because our goal is to be as inclusive as we can to as large amount of our community as we can.
Kestrel, does that answer your concern? You're on mute, Kestrel. Kestrel. There she
Sorry.
is.
I still have the question of whether the community, such as the Fenway Health Center, was consulted in regard to appropriate and sensitive language. That was my main, another concern of mine, aside from why were these questions being asked at all when the subject was addressing the needs due to visual impairment? Why does sexual preference or your original gender have anything to do with that service? But if you're going to
We have
ask
a
those,
desire to make sure we're servicing all of our community, and we can't know about that unless we have some understanding of the size of that community and other features, other demographic features of that community. That's the effort.
so
The
if
effort
you're
is to be able to engage our consumers as best we can.
So if you're asking those questions, then you should be consulting the community itself. And Fenway Health Center provides that kind of sensitivity reading when questionnaires like this are involved. And that was another concern, was just the language itself was just creepy.
Thanks for your input. Again, next year, when we do the process, we'll engage various community stakeholders, Fenway, whoever else wants to participate, will get input.
I mean, it seems, David, that the vendor needs to be a little bit more aware and sensitive. So that's sort of my observation here.
Yes, I concur. Thank you.
Okay. Guidelines pertaining to wearing masks and vaccination requirements for consumers. We've talked about that at the beginning of the meeting. Brief update from the June meeting on the comprehensive state needs assessment and the feasibility study to evaluate establishment of a for-profit business employing the blind. Any update? And I guess that would be Mary.
Yeah, I can give you a little update and then I'll hand it over to Mary. So I did meet with Kevin Lynch from National Industries for the Blind. We had one brief meeting, then one more substantive meeting. We've set up a further follow-up meeting to explore potentials of collaborating with either them or one of their organization, one of their affiliates, or, potential collaboration there. So Mary, though, I know you have something on the CSNA.
Yes, this is Mary again. I do. And I'm actually going to ask Susan to present with me. So Regina, if you could just share the screen, please.
And would you go from that, Mary and Susan, and just hop right into the dashboards after that, since you'll be sharing the screen?
Sure.
That would be great.
And Judy, if you have any questions, also just chime in, because you're part of this team as well.
Would you
So
blow that
anyway,
up a little? Would you blow that up a little, Mary?
All right. So Regina is sharing the screen, so sounds good. Regina, could you go to the registrations tab? All right, so one of the recommendations from this comprehensive statewide needs assessment had to do with outreaching to the rural communities, especially Western Mass, and the unserved and underserved populations. So one of the things we have done, I think, that shows we are headed there, we really are doing a good job with the outreach, is the What's Your Vision campaign. There has been a lot of outreach in Western Massachusetts and some parts of Central Massachusetts. And we have gotten a few individuals or community members who have let us know that the message is resonating with the community out there. And also with the new system that we have put together, the electronic system for registering consumers, and we did a webinar for eye care professionals. That worked really well because we're getting more good data from the eye care community. So with that, I'd just like to highlight that in 2017, we had total registrations of 1,740 for the year. 2018, we had 1,794. 2019, we had 1,860. 2020, we had only 1,063. And as of yesterday, we had 1,000 registrations at the commission. Now, in the past, June, July, and August are the slowest months. These are the months when we actually are trying to catch up on other things. But as of yesterday, we had about almost 300 registrations that are pending for individuals to be registered. So we have had a really banner summer for registrations. And I understand, this COVID, individuals are finally going to go see doctors. But at the same time, I have to believe that the outreach campaign is letting consumers, individuals reach out to doctors and they're getting diagnosed, and the doctors are being able to register the consumers. So we are anticipating that we may actually double that number. So we will reach the 2,000 by the end of the year. And in a conversation with Susan, hopefully you'll chime in, we were talking about if this trend continues through December, we are anticipating that we will really be able to use the money that we are getting in the budget. And I'm going to stop there and see if Susan has anything or Judy has anything to add on there.
Thank you, Mary. This is Susan. I think you've put together some good numbers to start giving us clues as what the dashboard would indicate. It does look like there has been some pent-up demand, so to speak, and that is coming. So before that demand started to surge, you were about at 704 for 2021. And the pending registrations of about 300 are the ones that have come in what period of time, you would say?
I would say mid-June to yesterday.
Yeah, so that's a lot in about a month and a half worth of time. So it does indicate that there is some level of pent-up demand, and you may see a surge in applications or registrations between now and December. And that's both good news and news that people are valuing your services or coming to the services as after COVID, but it does indicate that you may have some need to prepare for that.
Yes.
Yeah, I mean, I would assume, just looking at these numbers and what happened in 2020, that there's a lot of pent up demand as the people that didn't go to doctors in 2020 are going to go get their certificates. And then that's on top of the, 17 to 1,900 people that typically sign up every year. So, looks like you got to do about, if you do 2,500, you'll be about even. So you will be busy.
Yes. And I'm glad you mentioned certificates because in the last 2 weeks, we sent out almost 24,000 certificates of blindness. And we made a decision to send out to everybody 18 years plus. And so we've gotten at least 5. I know it's not much, but we have 5 individuals who received the certificate and decided they would like to re-engage with the commission. So we're looking at new individuals who are coming in, and then we're also looking at individuals who are re-engaging. So when we meet in September, we will be able to have the just new registrations and individuals who are coming back just to see how much. To see how these things are trending as well.
Well, that's good.
This is Amy. Could I, while we're talking about certificates of blindness, I have two questions that have come from consumers that I'd like to ask.
Yes.
One is, and I noticed this too, we used to get certificates of blindness in triplicate, and now we received one copy. Can you explain the reason for that?
Absolutely. So Amy, to print out the one in triplicate, I have to sit down and just keep pressing the button. And because it's an individual certificate, you have to go into the file and get the information to get on the to get it to print. So you can't really do a mass mailing. So what happened in the past is we have only printed for those individuals who wanted them, and then a lot of individuals were missing out on the abatement because they just didn't know they needed a certificate. So to really batch print the 24,000, we needed to find a quicker way to do that. The good thing about this certificate is you can make as many copies as you need. And also we have shared the information into the consumer's file so that if they call their counselor, instead of the counselor and then having to call center registration to print out another one, they can just print one or email it as needed.
Okay, thank you. And my second question that came from a consumer is, they got a certificate of blindness, as many of us did this month. However, their town requires that they submit their request for abatement before the end of April. So this certificate won't do them any good because it has to be a 2022 certificate. So how is it, are certificates going to be mailed to people annually in this way? And if so, what time of year will that occur? And if a person is in that situation where they have to submit abatement forms and so forth by a particular month, what is the procedure for getting an up-to-date current year certificate?
So one of the trends that we've seen in Sender Reg is we have a huge mailing in the beginning of July. Then we have a smaller-ish mailing in usually January through March, and that's for individuals who need it for April. And so yes, we will have another mailing. It's not won't be all 24,000, but we will mail that in. Yeah, we do another mailing in January for the.
And how will it be determined who gets the mailing in January?
We have a list of the individuals who usually request one for January. So we and then as they keep requesting, we just add them onto that list as well.
Can I interject for 1 second? Further though, we're in the midst of a complete business process redesign with the way we do this.
Mhm.
Part of that is contained within regulations, which we're going to be we're working on, and we're trying to get those finalized. But we've worked with the Assessors Association, okay? And it says that certificates are valid for more than just the year, is the point. Further, we're working on a more robust process to be able to come up with a better certificate of blindness, one that's more modern and can be emailed around and, you know, all that types of stuff. That's all in process. So what you're seeing now that Mary just did, this is a bridge to the future. This is an interim step. We're trying to be proactive here. And it's really, again, a testament to we've gotten such a new influx. It exceeds the numbers that we've seen before.
Right, and
also,
I appreciate that. I just, I think I will tell you that I know from the experience of many a consumer that the towns really don't care. They want a certificate for that particular year and they won't take anything else. So
Who's that though? The assessors?
Yeah.
That isn't the dialogue we've had with the Assessors Association. So Mary, maybe you could follow up and find out specifically who that is so we can address that, because the dialogue that we've had with the assessor situation has been, quite frankly, the opposite of that. So let's figure that out.
Well, maybe they're changing their position, but I know of several towns where that's true, that you have to have it for that calendar year.
Mm-hmm.
Mary, I'll be glad to send you info.
Okay, so why don't I'll actually reach out offline and we can come up with a solution that will work
Right.
for everybody.
Yeah. I'd like to, Joe, I'd like to make an additional statement about what this data and the dashboard are saying. I think
Please.
one of the things that is quite clear is that counselors are going to see an increase in their caseloads over the next 3 to 6 months.
No question.
And that almost potentially a doubling of who is on the caseload, because right now the numbers are down and expected to be so. We've just gone through a pandemic, and then there's this pent up demand that's seemingly resolving over the summer. So a couple of questions, given there's the union and some continuing communication, is that there's going to be a real need to look at things like grief and loss and empathy and that communication, that leadership to help people navigate this, because their caseloads could double or their caseloads could significantly be impacted. They're going to be potentially going into people's homes, or there's going to be a lot of change. So I just want to say that the underlying these numbers, which is good news, and you have the budget to carry it out, is a lot of hard work of counselors and between now and December at least. So I'm just making that statement to highlight that these pending registrations have with it a lot of gravitas during this time period, at a time where people have a little bit of fear and they're transitioning out of pandemic, about how they're going to do direct one-on-one kinds of interactions in homes. And this for the SAB is both, it's wonderful to see that there's the budget in place, there's efforts to figure this out, but the impact of this could be big on counselors. Meredith,
I
would you
agree.
with that? Yeah.
I would agree, and I think it also would impact both MCB employees as well as vendors providing services.
Yes. Yes.
One of the things that, as I listen to this, that I would counsel the commission not to fool around too much with the process by which certificates are sent, because there's going to be an increase in activity, and I think if it isn't smooth, and I know in assessor's office, the association can say one thing, but the bureaucrats sitting in the assessor's office in Plainville, Massachusetts, won't necessarily pay any attention, and it would create a lot of hiccups, and maybe this is not the year to do it.
So this is back to the issue that we just talked about with the mailing. So right now, our regulations don't allow us to share our list with the assessor. If we could do that, we could greatly streamline this whole process. We think there are ways to do it, and we're methodically working through those to still ensure the privacy of our consumers, but also get the gains and the benefits of being able to share the data with the local town officials and city and town officials.
Yeah, I got it all. My only advice is there's so much going on. This might not be the year to do it. And just a brief update from June on other dashboards addressing performance. Mary, were there more slides you wanted to show?
Yes, I do have one. Regina, could you share again?
Yeah, I knew you did.
All right, so Regina, could you go to the open SR and open VR? I can't even see it from here. All right, so right now, cases open for SR as of 6/30/2021, the program year. We have about 3,402, and that's just the social rehabilitation part. Of the social rehabilitation, we do have three buckets in social rehabilitation. We have children who are at 784. We have adults, regular adults, and that's 1,598. Then we have the deaf blind extended supports at 1,020. Now, the interesting thing about the 3,402, we do have some consumers that they get close and then the vision changes, so they come back. So we don't include the instances where they come in. So we only just do the individual person. So the instances of services could be maybe will be about at 5,000 where the individuals have received services or they're open at one point or the other, but we only just look at one point in time and we look at individuals who have received services at that time. So if you scroll down, Regina, for the VR and transition youth, so we have 848 VR consumers. Of those, pre-employment transition youth is 143, and those are the ones who are receiving services. And we have in the 143, we also have the kids who are potentially eligible. So they're not registered with the commission, but they are receiving pre-employment transition services. And one of the trends we see is that many of the youth, I would say 99% of the potentially eligible usually sign up for VR services because they are we have a really robust VR program. Youth in transition, we have 153. Now that's really important. So for the pre-eds and the youth in transition, we have 296 consumers. And Joe, it goes back to the reallotment projects. And so when we are looking at mostly serving the youth, we are going to look at programs for the 296. And I'm sure next time we meet, we will have something to let you know what we're doing with some of those of the youth. And so the remainder is VR adults at 552. Some of those 552 are in college, so they're still in training. They're not looking for jobs yet. And so we tend to close between 120, 150 consumers successfully. So that jives with the trends in the past. However, as I was talking to Susan, let her know that from the 300 consumers that are pending registrations, we're going to go in there and triage those individuals who are 14 to 65. That's about when we do VR, we send them to VR, and then the counselors do VR eligibility because they are trained to do the actual assessment for VR services. So it will be interesting to see how many of the 300 we actually wind up on the 848. And I'm thinking we are going to have, that number is going to go up because just a cursory glance at the registration showed a number of them who are in that age range. So any questions?
Yeah, and Mary, this is great numbers and thank you. I know we're still experimenting with the dashboard, and it'd be great for us to continue to meet with Judy. And I think one of the things that has been a concern over the years at MCB, or not a concern, but something that you're looking at, is what percentage of youth you have in the program, who's coming into MCB from a young age. Across the country, VR agencies, particularly general agencies, are seeing 54% of their customers are young people, 14 to 24 in general. And you still have a majority adult population at this moment. So with all the outreach that you're doing and all the reallotment projects that you're doing, a lot seem to be targeted to youth. Not exclusively, but there's a focus on youth. It would be good to use these numbers to track when you're doing those kinds of outreach efforts, to see if you start seeing bumps in who's coming in at that age range. And that might help you also plan for what kinds of college expenses you might end up having. So there has been a real national turn in VR toward a 14 to 24 age range. And for blind agencies, that sometimes has the concomitant response that you see a lot more college tuition expenses. Hard to know yet, but this is another way that maybe with the dashboard, we can look at age range and types of expenses that you may be able to predict might happen, and to look at what Carla is doing with a lot of the outreach activities. Are you successful with youth, and which youth? I think our rural youth, by race and ethnicity, by other factors that the needs assessment raised. So I really appreciate the effort, and I think what you're doing has potentially gives you a lot of knowledge for how to plan for different services down the path.
Thank you. So I think we'll share that for now, and then we can work a little bit more on more, Joe, for next time.
All right, thank you, Mary and Susan. Brief update from June meeting on strategic plan to track performance of employees and delivery of service. Is there any update, David?
Say that again.
That we had talked about at the June meeting, that the commission was working on a strategic plan to track performance of employees and the delivery of services.
I'm sorry, that one fell off our radar. I don't remember that.
Okay.
What is that referring to? Mary, do you remember what that is?
So I wasn't at the June meeting, but I'm familiar with that. And Susan, we talked about one of the things we'll do for the next time would be to look at the population of the numbers of the consumers, and then put there the number of counselors for each group of consumers, and see how the caseloads merge. Is that something does that sound familiar?
Yeah, I think the wording might be a little bit tricky, but yes, exactly. I think one of the big questions was pacing and onboarding. It was not just the performance of employees per se, but movement through status, and how folks are moving in from registration in through IPE, for example. So it wasn't, or it was more organizational than employee performance.
So we'll be a little bit more specific in the ask. David, AIM Library, I thought I saw from the commission an update that the transition was done. You've brought over the same people that ran the AIM Library prior to June 30th to after June 30th. Anything else to add there?
Yeah, so just to clarify, so Carrie Brazier is the manager of the program. I was able to hire her, and that's a management position. The other positions, though, did go out for posting. The incumbents all applied, and in both instances, they became our candidate and are hired. We've subsequently hired them. We've added an additional person who will actually be beginning on Monday, this coming Monday. So the good news is, speaking with Carrie, she believes that the communities, like the TVIs, and she's in touch with like AIMSV and many of the people that use those services, have received the news well, and they're pleased. We've been able to keep her working uninterrupted, so kids are all going to get their books for school. That's a good thing. We've gotten her set up in our payment system, and book ordering is going on. So I won't say it's been seamless. There's been some hiccups, but by and large, everything's worked out well. Actually, we were scheduled last Friday to have a tour, but that got postponed because the Pappas Center down there was a COVID breakout. So we're in process of rescheduling that. I think we're going to do that sometime in mid to late September or something. But otherwise, that's going well. And I think it's been received well generally.
Joe, I think you're on mute.
Muted, I think, Joe, yes.
I'm sorry.
That's okay. You probably
I'm
got a
sorry.
great lot of wonderful things to say, and we missed it all.
I did, and I forget what I said. No, should the meetings going forward be virtual, hybrid, or in person? I think it's all very fluid right now about what's going on. I think we can deliberate that over the summer, if that's okay with everybody.
Yeah, Joe, I can just add, this is Kim, that I'm the chair of the Watertown Commission on Disability, and we've been given the clearance to meet through April, according to the current statute or dispensation. So we should put it on the agenda. I don't think we need to talk about it until after the first of the year, but I would assume we would continue to meet virtually if we can, because the participation is so much better and it allows consumers to participate in the process.
Okay, there are some questions. I need to get off for 2 minutes and I will be back on. But in my absence, Susan or Amy or Kim, there was a question from Russell. I don't know if there's any other business that people want to discuss before we have a few more Q&A. There's really, I did have one question for the commissioner. I see publicity for the job fair. Are there sponsors this year for the job fair?
I wouldn't say sponsors. I would say we're collaborating with many of our stakeholders that we have in the past. Yeah.
Because usually when something comes out, it does show who the collaborators are. And I do know that from my involvement in prior years that a lot of those collaborators, particularly Perkins, Carroll Center, I don't know if Radcliffe is still involved in it, put in
Yes.
addition to money, a tremendous amount of time. And I just didn't see that.
Yeah, we had modified that in recent years. And then last year, because of COVID, it was virtual. I think one of the things we were contemplating and now up until recently, we were going in one direction, but now with this latest guidance and everything else, it's most likely going to be virtual again. And we're trying to figure out how best to be able to serve the community and what features to bring in on that. Carla, do you have more there? I know we had talked about that briefly with John and Joey and Carol.
I did attend, this is Carla. I did attend the last job fair meeting with the committee and partners. And
all right, guys, I'm going to hop off for a minute and I'll be on in a minute. We can take Russell and Jane's questions.
Okay.
I'll be with you in a sec.
I will could just continue with that response about the job fair. I did get the opportunity to meet the last meeting with Joe and Carol and Deputy Commissioner John Oliveira and all of the partners that are part of the job fair. They did make the decision to move the event entirely virtual this year, but did explore some other platforms for the virtual event and decided that Zoom was going to be the best platform to use. They are holding it for 2 hours from 9 to 11 on October the 1st. And it's going to be sort of a reverse job fair. So individuals will be presenting to 2 separate groups of employer partners for those 2 hours and giving their elevator speeches. Resumes and information will be provided to the employer partners prior, and then vice versa. Information about the employer partners that are participating, links to their career sites and to their career listings will also be shared with the individuals who are participating before. So a lot of kind of advanced knowledge will be shared, and then the event will be streamlined for the participants to present. So it sounds pretty exciting.
That's great, Carla. This is Susan on the SAB.
All right,
and
good.
Joe,
I am.
Joe, while
I'm
you
back.
yeah, thanks, Joe. I see you back. Thanks for that. I did want to get in before we move to the public comments. Carla, I have been following the postings that you've been putting out on social media and other places, and they've been great. I think you're providing a lot of resources through the MCB Facebook page, through other activities. I saw something today profiling a staff member, Linda Geary, I think.
Yes.
And on the children's program. So I've really seen an uptick in that, and I've seen some of the cartoons or the animation coming out and the efforts that you're doing. So it's noticeable. There's been a very big uptick in what you've been providing, and hopefully it's getting out broadly and people are seeing it, but it's impressive.
Well, thank you, Susan. We have 2 really great interns, one of which is from our community this summer, and I really I really just want them to stay through through the end of the year. They've done a tremendous job. So thank you so much for that shout out. I'll pass it along.
Yeah, definitely. And if you know, it will be good to see if we start seeing a lot more youth enrollees. So really great.
Can I just interject for a second, Carla? That's so like you. I love our interns too, but it's you. Carla deserves a lot of the credit.
Well, thank you very much. It's a very busy time at MCB. There's always a lot going on and no shortage of things to share. So it's exciting that we have these new channels like social media that are now up and running, really escalated to get those up and running due to COVID and all of the communication that we had to share due to crisis, but grow and engage more of our community members, also our stakeholders and other employer partners. So I think in combination with the What's Your Vision campaign, we've really seen an uptick in engagement in the past couple of months that kind of mirrors what Mary also showed with registrations. So we do think that part of that is because people are really hearing more about MCB and are engaging on a more consistent basis on those channels. They've really learned to go to those for information. So please share anything that you find valuable for our community. And we are always willing to take a look at that and share that via a number of channels too.
All right, thank you. I can't see the screen, but there were two hands raised, I think, Jane and Russell.
Hi, Joe. It's Regina. Yes, so we have Russell Andrews. If you can unmute yourself.
Hi, Russ Andrews here. So my comments are about the certificate of blindness. I've been calling and ordering one since 1985. And yesterday, my partner Julie says, "Hey, I'm going to go drop this off at the town hall." Where'd you get that? I don't know. So thank you so much for sending it to me automatically. It's so much easier. And if you're looking for a town that doesn't accept anything but the current year certificate, Northbridge, Massachusetts. Every year they tell me the same thing. I have to have one from this year. So you were looking for a town?
Yes, Russ, thank you for that. And that is just the type of information that helps us be able to go to the Assessors Association, because they tell us like, oh, they shouldn't be doing. So, you know, which one, they put like both ends against the middle. Further, the regulation change that we make should address that, because our regulation change will be able to speak to them being valid. Right now, it's not as specific on that, and so we're gonna change that. It'll be good. So thank you for that input. That's valuable. Thank you.
Cool. Thank you for listening.
Yes, appreciate it. And I'm glad it worked out. That's what we try to do. We try to be proactive.
It worked this time. All right.
All right,
I'll end now.
Regina.
Thank you.
Regina, is a 508 still with their hand up? I think that's Jane.
Yes, Jane, if you want to unmute.
Hello again. Yes, it's Jane Perry. Thank you, Mr. Chairman and members of the board and the commissioner and the staff. Two comments and then I have a question. First of all, I'd like to tell you that your PSA has been on Channel 4 twice since the last meeting. Around between 4 and 5, Channel 4, Judge Judy, your PSA about the Mass Commission. So you are out there. And also, even despite the issues that we're having within the agency, Massachusetts is a leader in services for the blind and visually impaired, because I belong to the American Council for the Blind and the Bardet-Biedl Syndrome Family Association. And the people and my friends that I talk to can't believe the things that I have available to me as an SR person. And I even have told them about the OIB program, Older Individual Blindness Program, that Karen Hatcher had presented at our site law service meeting. Regarding the open meeting law, I want to thank Deanna and Kim for bringing that forward. In our town, if you're a volunteer on any committee, when you sign on to that committee, you have to go on the town webpage under the selectmen and take an ethics test that has containments about conflict of interest, public records law, and the open meeting law. And you print a certificate, and every year you have to sign off that you understand all of that information to the best of your ability. So if you have any questions, you can go on the state ethics site, and all that information is there. Now, communications. The Commissioner Carla knows I'm a big communication advocate. And
Yes.
thank you, Amy, for bringing about the newsline issue of putting things on the newsline. Because, as Kim knows, I love my newsline. I listen to about 4 or 5 times a day. So the mailbox is there for MCB, but I think we need to update it with the newsletter, a calendar events, and maybe minutes, so that people who are older, that I advocate for, and I am one of them, on Cape Cod, and I know there are other areas within the Commonwealth that have older people that are not computer savvy or don't want to use a computer. That is their communication link. My question to the Commissioner is, has an O&M director been hired? I know we can never replace Miss Meg
Yes.
Robertson. She has been a very good mentor and inspiration to me. I just attended an ACB conference on transportation track, and I learned so much this week that I had questions I was going to ask her, and but she has gone now, and we have been in contact. But I also want to know, and I don't know if this is a RAC issue that should be brought forward, but we need to look at transportation. It's a statewide problem. I don't know if someone from the administration goes to the MARTA meetings, which is the Mass Association of Regional Transit Authority. There's a representative from each regional transit authority. I know you talk about the MBTA because that's the biggest one in the state, but if you want your consumers, and I know I do, to be independent and control their dignity and keep their pride and realize that they can be dependent and go on their journey of sight loss, as I have in the past 34 years, and still be an independent person. And I want to thank you and I have advocated for SR programs, and I am one of those. And it's through these meetings I have attended since the first of the year that I have learned so much about what this agency does, what the conflicts are, how they've been resolved, and I thank you for allowing the consumers to participate. I think there should be more of that. I think there should be more open town meetings with the listening sessions, just not with presentations. So I hope you take those comments to heart that I have made and questions, and I will be back next month. And I hope to continue coming to these meetings. Thank you for your time and opportunity for me to speak. Thank you very much.
Thanks so much, Jane. Are there any other questions?
Can I just work through some of the issues that Jane raised?
Please.
So Jane, thank you for that. I appreciate you. Carla, I'll ask Carla to address the newsline thing, but just for everybody's edification, we did hire a new O&M director. Her name is Allison Bull. She's terrific. And we hope to have her to a future meeting, maybe to introduce herself or whatever, but she's hit the ground running. We're actively planning for events in October around white cane awareness. And we're going to have a Meg Robertson Award. It's going to be great. So Allie's really good. And so just on that, Carla will address Newsline. And then on the last thing you raised in terms of the reciprocity for having our blind ID be accepted everywhere. Right now, the blind access card is accepted on the MBTA and a couple of other transportation providers. Prior to COVID, actually, we were in a dialogue with MassDOT about reciprocity, about having our card being honored on all systems. Now that COVID is subsiding, we're going to strike those back up again to get into a dialogue, because really we're going to be coming up with a new way. We're in early stages of a new process of a card that really matters. Right now, like, for example, there's two cards. One is the blind ID card, that's an MBTA issued card, the Charlie Pass. But then the other is our MCB ID. I'd like to fold those both into one and make it a respected ID. In other words, an ID that's honored to be able to get you on a plane, to be able to get you in a federal building. Like, those types of things. Currently, our IDs don't really do that. Like the T ID, the blind access card, it gets you on the T, but you can't really use it for anything else. And then our ID, you really can't use it for much. You know what I mean? So our goal is to kind of combine them and have it be a robust ID. We're in process on that.
David, this is Amy. I thank you for that information because I was actually going to ask a question related to that. I know there had been some discussions a while back about working with the registry, and it wasn't clear exactly how that was going to work, but I'm wondering whether that option to work with the registry in a way so that we were talking even about getting MCB potentially out of the ID business is still going on.
Yeah, those discussions are being renewed.
Wait. Go ahead,
Excuse me,
David.
can I just interrupt for 1 minute?
Yes, Jane,
Can we
hi.
put the next agenda about transportation issues in this reciprocity issue? Because I was Falmouth's representative to the Cape Cod RTA, and this is one of my goals, is to make seamless transition, to go from any state, any town and state, and go back and forth and use the same card. I
We
think the
share
problem,
that goal, Jane. We share it.
excuse me?
We share that goal. That's my goal also.
Okay, well, I will be in contact with you, and I hope you'll be in contact with me, because I think the MARTA is the first step to work towards.
Of
Because
course.
I know Mr. Kerr, who is our executive director, who was a deputy secretary of this transportation department. I have talked about that, and I think it has to do with a financial issue, but I really truly believe that it can be doable. So I would like to work with you on that, and I will be in contact with you. Thank you,
Thank
Commissioner.
you, Jane.
Joe,
David, could you finish your answer to my question, please?
I'm sorry. Could you just say that again then?
Yeah, no, I was just saying, it sounded like you were interrupted in answering my question about the registry.
Yeah. So we're going to renew that. Matter of fact, we've already renewed it, but now we're gonna start. There's been a change in the leadership there. So when we had the dialogue going, it was with then Registrar Tesler. Just the other day, Registrar Tesler was officially named as the new Secretary of Transportation. So having Jamie Secretary Tesler as the secretary, obviously, I think is going to help us in our process. We have a good dialogue with going with the registry on the card. So yes, we're renewing all of those issues. There are some that I'm not at liberty to say right now on the registry side of the house, because while it may seem easy, but if we're going to have our ID respected as an own unique ID that can get you on a plane, get you in a federal building, those types of things, there are a number of parameters that we need to meet. With that said, it's more than just the RMV. There's the federal aspect of it. There's the public safety aspect of it, because public safety and the registry, those systems talk to each other. So it's a bigger dialogue, but I think we can do it. So that's in process.
Okay, great. Thank you very much.
Please let us know if this can work for you.
Joe, this is Susan. As we wrap up, could I request that we work towards setting a September date and make it possible that local recordings can happen at that September date?
Yes, please. I was going to suggest that why don't we by email come up with a date over the next week or so that the date can be published. And yes, absolutely. We want to have it so that local recordings can be made.
Hi, Joe, it's Regina. Also, if we want to look a little bit further into the future, I can create a recurring meeting so that the Zoom link would actually stay the same. So we can just reuse the same information. So if we wanted to look, say, at October, maybe November, going forward, we can maybe book it in advance.
I'd be all for that. Why don't we, somebody on your end get some suggested dates out. We'll all work to get on the same page so that we can agree on them, get them on the calendar, and publicize them.
Yeah, I think this is Kim. I think that's a great idea. And let's shoot for doing through December just to finish the calendar year. I think that'd be great.
That sounds good. And as soon as we settle on the dates, then we can post the information.
All right, great. Well, thank you very much, everybody. Enjoy the rest of your summer, and we'll reconvene in September.
Thanks, everybody.
Thank you.
Thank you.
Hope everybody has a great
Bye.
day.
Thank you.
Bye.